Good afternoon, and thank you for the invitation. It's unfortunate we cannot have this live in Rotterdam, but such is the case. And I have no conflicts to declare. What I would like to do is start with what was my original message, which was to explain to you why I'm passionate about preparedness research, and that has to do with the threat of new infectious diseases coming from the animal world. But what did we know at the time I received the invitation that we all would experience what now has become a pandemic, a new introduction, exactly the type of topic that was the focus of this presentation. So this started with the first message about something strange going on end of December 2019 in a Chinese financial journal that mentioned cases of unexplained pneumonia related to a market, a live animal market in Wuhan. And in the weeks that followed, it became clear that this virus was expanding, but there was hopes that it could be contained similar to what happened with the SARS outbreak in 2003. And here is an image from mid-January looking at the flight routes out of Wuhan into Asia and the rest of the world, which already shows a big difference with the situation in 2003 with the SARS outbreak, namely the connectedness of modern day China. What followed is, you are all familiar with that, and we are looking at a global pandemic with now over 42 million cases, over 1.1 million deaths, and this number will definitely go up as we can all see. Now, was this a total surprise? No, it wasn't, because the basis for this type of epidemic has been discussed already for some years and has led to the development of the RD Blueprint for Action to Prevent Epidemics, which is a WHO program to focus on priority diseases and to encourage the development of medical countermeasures for those. Listed there are a number of high impact pathogens, and you can see that MERS and SARS coronaviruses were on that list. And that's also what we benefit from in the fast track development of some vaccines. But was also put on the priority list is disease X, and disease X is there to remind us of the increasing risk of global epidemics and pandemics. And the reason for that is change in many different aspects. We talk about the fourth epidemiological transition, which has entered now a phase where we do see noticeable impact on the health of humans as a result of human impact on the planet. And there's many examples that you can think of. There is the fast population growth, the development of mega cities, the impact that has on the environment, the political landscape, including instabilities, and of course also climate change. And wherever you see such change, what we start to see is that pieces of the puzzle converge into an overall increased risk for new disease outbreaks. And because many of the new diseases originate from the animal world, that's also important to realize that how can we maybe move our ability to predict events at a much earlier phase. We now look at a global pandemic, so virus that has become human-to-human transmissible. But there are numerous other viruses in the animal world and wild animals that may spill over. And it is important to understand what are events that lead to further transmission and eventually global dispersal. And there are certain aspects of that I would just like to go over. Let's first zoom in into the origin of the SARS-CoV-2 virus. And at to date, that's actually not yet entirely clear. I think there is consensus that the original reservoir has been this bat species, and that is because there's clear evidence of viruses, viral genomes in bats that are highly similar to the SARS-CoV-2 virus. Here it still was named 2019 new coronavirus. But there's also another candidate here in this guy, pangolin, with the discovery of a pangolin coronavirus earlier this year, that depending on how you do the analysis, is even closer in similarity to the new human coronavirus. Nevertheless, both of these viruses are still too distant to speak of a direct causal link, and there is a missing link that still needs to be identified. There is increasing evidence that of a range of animal species that are susceptible, and what stands out is the extreme susceptibility of mink, now experimentally also documented in raccoon dogs that are quite a big production animal in China as well. So in my view, that is something to look into. But also some of the other drivers. So I mentioned the pangolin, which is an endangered species. So why would that now be? It's an unlikely source of introduction, but it is the things that we do with these kinds of animals. Because pangolin, in addition to being near extinct, is also a delicatessen, particularly in this part of Asia. And because of that, there is a market with an increasing geographic range to get animals in there to be able to serve them. And they go at high prices also in restaurants in Vietnam, which is also a tourist attraction. So there is a relationship to tourism and local preferences, and from there these animals are also introduced into China. Now, this is an example of what we quite often see at the root of a spillover event involving wildlife. So there is somehow the entry into the food chain from humans. And this is a busy slide, but it is a scenario tree that was developed by the Food and Agricultural Organization, and that looks at the different activities from hunting to introduction of virus possibly in farmed animals, which you then slaughter, which gives exposure, which also contaminates an environment, and that can all make it onto markets. And depending on where you look, you have these different people at risk for as first cases. Then moving on to a second big example of amplification. So these accidental spillovers probably have happened forever, but what is changing is the likelihood that then leads to onward transmission. And this can happen in animals as well as in humans. And here's an example of why changes in the animal world and animal farming may play a role. This is an example from MERS coronavirus, which is a virus that possibly also from an original reservoir bats has made it into dromedary camels and is widespread in dromedaries in the Arabian Peninsula. And what happened there is that over the course of the past few decades, the keeping of those animals has dramatically changed because of fast growing wealth. Originally, these are animals that are left free to roam, but nowadays, here in an example from Qatar, they are actively farmed. And why is that? Well, that is because of the consequences of the fast development of wealth, which was a result of the discovery of gas and oil fields, And what happened is that wealthy individuals in the entire Gulf region have started to buy so many camels that has become an ecological problem. And as a consequence, instead of free roaming, these animals now have a mandatory farming band, or they are farmed commercially. This happened in Qatar in 2011, and that of course completely changes the interactions and increases opportunity for virus transmission among animals. That's also what we see there. So this is a central market in Qatar, where animals are brought together from all over the region, kept for a couple of weeks, and then either selected for racing or for other purposes, or put into the slaughterhouse. And in that marketplace, if you then sample the animals, 1 and 2 of them will be actively shedding MERS coronavirus, which is extremely much higher than what you see in free-ranging dromedary camels. So that increases the risk of exposure of humans. Now, what also is an important driver of disease emergence and of explosive outbreaks is population density, and particularly the fast development of dense cities with unequal growth, so with slum areas. This is an image from the West Africa Ebola outbreak, and these circles are urban slums from where the virus really spread explosively. These connections are made based on the genomic tracking of the virus. But this urban transmission is also what happened in MERS. So with MERS, what we do see is this virus is actually not so transmissible between humans, but we see a constant trickle of new spillovers, but occasional peaks, and those peaks are related to person transmission in hospitals. So it is possible, and that's why MERS made it onto the priority list in the WHO blueprint. This one in red was a particular outbreak that happened in Korea. So introduced by a single traveler who visited a couple of hospital emergency rooms before deciding where to be treated, and that seeded a widespread outbreak with close to 200 cases and many people in quarantine. Here, 16,000 people have been in quarantine over that outbreak. So just a single introduction already leading to this, and that shows the potential threat associated with this virus as well. Now, there's a very particular category where we also see shifts, and that's in vector-borne diseases. So these are arboviruses, arthropod-borne viruses that have a reservoir host. In this example, it's monkeys. That's for yellow fever, for Zika. And they are maintained in that reservoir through specific mosquitoes that like to bite them. And if you have an individual, a person walking into this ecosystem, they may get infected. So you get a sylvatic case of yellow fever, for instance, but that's where it stops. But that can change dramatically if the reservoir function is taken over by humans, and that may happen if the virus is introduced in a highly populated region, which also has conditions that are favorable for mosquitoes. And that's what has happened on several occasions. The most recent example has been the Zika epidemic, declared here by the previous chair of the World Health Organization, when the Ministry of Health from Brazil found a steep increase in the notifications of babies with microcephaly. And that you all presumably remember that outbreak, which really expanded explosively over more than 4 countries in a matter of months. and with that caused an epidemic of babies with very severe birth defects. Now that is that the last point then is climate related changes. This is a map of Europe where you see trends in annual temperature from 1960 to 2019, and you see that overall there is increasing temperature. We're all familiar with that, and the speed of increase is projected depends a lot on what we can expect to see in terms of emissions in the future, but it is an upward trend. It will be warmer. And we are seeing effects of that as well. Just a month ago, we had the first notification of West Nile that was in a specific bird here, which is a bird that migrates from Africa. But given the time that we detected this, this was likely a locally transmitted case. And by now, what we have found is several additional birds positive for West Nile virus, a virus that we have seen in the south of Europe, and since a few years also in this part of Germany. And by now we find positive mosquito pools, we find positive humans that had been missed in the diagnosis, and there is screening of blood donations ongoing. So another situation where we see that we may now be looking at a new problem even this far north in Europe. Now, just before I close, just a few words that what we're looking at now is the pathogens that we know, but we also know, and there's good evidence that there's a lot of undiscovered viruses out there. So in terms of preparing, we really need to have an open mind of what to prepare for. And that is the basis of what we are focusing on here is One Health preparedness research, which says let's not wait until people get sick, but let's see if we can try to understand what is going on in the animal reservoir, in suitability for vectors for transmission, to see if maybe we can have an earlier warning of new situations evolving, like the West Nile virus example. And that also means a shift from anthropocentric research to ecocentric research in order to get more lead time. What also is very important is that this preparedness should include clinical preparedness. I think the pediatric population in the SARS-CoV-2 outbreak, fortunately, is not that heavily impacted, but Zika has shown us that may also be very different. And I hope we take the lesson from this pandemic to rethink how we do things in the future. So with that, I would like to close, thanking all the partners in two large collaborative projects around this focus. Of course, the people in my department and the funders that allow us to do these studies. And thank you very much.